Figured I'd give a little more comprehensive update of what's been going on since my liver transplant. And this video probably seems to be the best way to go about it. Essentially, I've just been going through a little bit of challenges with immunosuppression and now organ rejection of the new liver. To recap a little bit, going back to roughly 2 months after transplant, I had been complaining about the main immunosuppressant drug that they had put me on called tacrolimus or Prograf. This one just gave me a lot of nasty side effects, from neurological, like weird nerve ending fillings, to extreme pain in my ankles and joints, to just feeling like a complete zombie and not being able to think straight. So after multiple complaints about that drug and nothing happening, I decided to wean myself off of it. After about a week of weaning off, only taking it once a day versus twice a day, I completely took myself off for about 3 to 4 weeks. When I had my 3-month follow-up with my liver team in Denver, I let them know that I had taken myself off of it due to those effects. And at that time, the main doctor I meet with was concerned that she was going to have to admit me to the hospital due to potentially rising lab numbers. Come to find out, those test results came back that same day and everything came out fine. My numbers weren't perfect, but they were well within range of 3 months post-transplant. Yet I still agreed to go back on the Prograf super low dose, just to kind of make a compromise with my doctors, as they were a little upset that I took myself off of it, understandably, but understandably I had been complaining about it for a while. So, like I said, I went back on the Prograf or tacrolimus for probably another couple weeks, maybe a week, before I complained about it again, even at that low dose. And then after that complaint is when I was finally introduced to a second option called cyclosporin. So we switched out the Prograf for cyclosporin, and the cyclosporin is quite a bit better as far as side effects, but it still makes me feel pretty weird. It does some weird stuff to my esophagus and definitely just makes me a bit brain foggy. So I guess to go back to that point, I had a phone call with my actual surgeon, the one who transplanted my donated liver into me, and his words to me during this phone call were that he didn't care if I called Anderson Cooper or even the Pope, that he would not give me another liver transplant if this one failed, as if I asked for another one. And that was completely uncalled for one, to treat a patient like that when I've been complaining about things for a little while and I make my own health decisions, and people want to attack me. That's fine. So anyways, had a biopsy about 3 months ago, and that biopsy showed that there was some T-cell mediated rejection going on. Following that, I did a treatment of solumedrol. It's kind of a high dose steroid, I believe, that kind of just jump starts the immunosuppressant drugs that I'm already on and just drops my immune system down. So I did that one treatment after that first biopsy. Lab numbers still weren't getting better after 2 or 3 weeks, so I did a second round of solumedrol therapy here locally. After that didn't really work, my lab numbers still kept rising as far as liver functions. My liver team decided that I needed to go up to Denver for a more intense treatment with a drug called thymoglobulin. So I spent 7 days up in Denver on a thymoglobulin treatment, which was pretty rough. Had some pretty bad experience during that week, from the nurses not being able to hit veins very well, blowing out veins, even though I have perfect veins for drawing blood and putting in IVs. For almost 4 weeks later, both my forearms are still super sore from all of that. I was served moldy strawberries while I was in there. The whole week I was in Denver, not my surgeon nor the main doctor that I talked to even came to see me once while I was there. I found that kind of odd, considering both of them, yet one of them mainly, had been wanting to talk to me about all of my concerns and not wanting to take this medication and all of that, yet they had ample opportunity to come talk to me while I was sitting in a hospital bed for 7 days, yet not one of them came to see me. I lost a consistent 1 pound or so a day while I was up there, and it wasn't until the day before I was discharged that a dietitian came in and let me know that I was able to order boosts, nutritional supplement drinks, through the cafeteria, even though they weren't on the menu. So that would have been nice to know the first day I got there, because the food was crap, even if it was, not spoiled or fresh. So after that, let's see, I come back home after that treatment, and lab numbers still don't look the best, and then last week my numbers spiked pretty high. Bilirubin went up to a little over 7, and the other liver enzyme numbers were also pretty okay. So from there, I just had another biopsy 2 days ago on Monday. Let's see, Monday, December, what is it today, the 30th, so it was the 28th, Monday the 28th. That biopsy, still waiting on final results from the liver team in Denver, but the preliminary results from St. Mary's here in Grand Junction show that my liver is scattered with lymphocytes, which are immune system cells. So essentially that would indicate that my immune system is definitely attacking the new liver, even with my immunosuppression. Kind of waiting to see where we go from here, trying to get the final results from the biopsy that I had and see what we want to do. My doctors in Denver mentioned that if it is still rejection going on that caused my numbers to rise, and it's not just some bile blockage or bile duct blockage, essentially, that they would want to consider putting me back on tacrolimus, which I'm not going to do. The most I'm going to do is the cyclosporin and the Lyfortic immunosuppressant that I'm currently on. I will not go back on that tacrolimus medication, as I wasn't alive when I was on it. I mean, I was physically alive if you were to take my vitals, but I wasn't here. So that pretty much catches everything up. I just want to thank you all for still continuing to view this and support me and share the love. That's about it. Thank you again. Love you guys. Bye.